Enterobius vermicularis, a parasitic pinworm also called as threadworms, an organism that primarily lives in the cecum and ileum of the intestines. They are visible to the naked eye. Adult worm is a small, white in color, more or less spindle shape, and resemble a short piece of thread. Adult males have a blunt posterior end with a single spicule. Females possess a long pointed tail, and both sexes there are cephalic expansions. Preschoolers are at high risk of contracting pinworms due to their behaviors and habits. Some reasons for this risk include close contact with other children. Preschoolers often come in close contact with other children in daycare or school setting, which make easier for the pinworms eggs to be transmitted from one child to another. Next will be poor hygiene habits. Young children may not always practice proper hygiene, such as washing their hands after using the bathroom or before eating. Next will be sharing items. Preschoolers tend to share toys, utensils, and other items, which can facilitate the spread of pinworm eggs from an infected child to a healthy child. Next will be exploratory behavior. Young children may put their hands or objects in their mouths or frequently increasing their chance of ingesting pinworms' eggs. And lastly, weakened immune system. Preschooler immune systems are still developing, making them more susceptible to infections like pinworms. The life cycle of Enterobius vermicularis. First is eggs on the perennial folds. Next will be infections occur via self-inoculation, transferring eggs to the mouth with hands that have scratches the perennial area or through exposure to eggs in the environment. For example, contaminated surface, clothes, bed, linens, and etc. Following ingestion of the infective eggs, the larvae hatch in the small intestine. Next will be the adults establish themselves in the colon, usually in the cecum. Next is the time interval from ingestion of infective eggs to oviposition by the adults. Females is about 1 month. At full maturity, adult females measure 8 to 13 mm, and adult male is 2 to 5 mm. The adult span is about 2 months. Gravid females migrate nocturnally outside the anus and oviposit while crawling on the skin on the perennial area. Next is the larvae contained inside the eggs develop. The eggs become infective in 4 to 6 hours under optimal conditions. Pathogenesis produce an enterobiasis that is frequently asymptomatic. Perennial pruritus, especially at night when the worms migrate and become more active. Enterobiasis means pinworm infection. The signs and symptoms are anal itching, abdominal pain, nausea, restlessness, irritability, and insomnia. Diagnostic test. The doctor can confirm the presence of pinworm by identifying worms or eggs. To help your doctor to make diagnosis, you can perform tape test. As soon as he wakes up in the morning, before he goes to the bathroom or washes up, put the sticky side of a piece of a clear tape around the anus and then remove the tape and look for pinworms or their eggs. Treatment to treat Enterobius vermicularis, including antihelminthic agents such as pentothal, mebendazole, and albendazole. It's important to treat all family members to prevent reinfection. Prevention and control. Strict observance of good hand hygiene. Keep fingernails short. Cleaning polluted items on a regular basis. Avoid scratching your ass directly with your hands. And lastly, healthy body, wash hands regularly.